So we'll call the meeting to order. It is now exactly 7:30. And so before we get started, would everybody have a chance to review the minutes from last meeting? Are there any additions, corrections, comments? Any motion to approve the minutes?
Second.
All in favor?
Aye.
Any opposed? Motion passes.
All right.
That's good. I guess we could start with Sam's report.
Sure. So this month, in terms of COVID activity, we saw a peak around the third week in May, and for the following 3 weeks after that, we saw a consistent decline in cases. This past week, we did see a slight increase in cases, up from 55 to 66 cases. So hopefully that's just a temporary thing, but we are seeing cases trending downward, which is good. Last week the state, a few weeks ago, the state peaked around 11,000 cases per 7-day period. They do it like each day for the last 7 days, and so about 3 weeks ago, 4 weeks ago actually, May 16th, they peaked around 11,000 cases in the last 7 days at that point, and now we're down around 3.5 thousand cases in the last 7 days. So we're a really significant reduction, both in the Fairfield County and the state level. We're seeing hospitalizations trending downward, and the state test positivity peaked around 14.2, right around that same time, and now we're about 7.6, so nearly half reduction in positivity as well. Fairfield County, with the new CDC's community levels approach that they're taking, where they factor in hospitalization data, we did see over the last month, we did see a peak of us going from low to high, and then now we're back down, just last Thursday, back down in the low category again. So, which is good, and hopefully the things will keep trending that way. In the U.S., cases over the last month for the U.S. are about level. We were seeing a decline, then it kind of plateaued out and it's kind of been level for the last month or so overall. But in Region 1, which is roughly New England, since the 26th of May, around that time, hospitalizations have been trending downward. But overall in the U.S., we are seeing some trending upward. So it's consistent with what's been happening. We usually see some peak in the spring here in New England, and then it starts to go down, and then the South picks up in the summer. So we may see some increases there. We've had a few clinics this past month. We've done booster clinics for 5 to 11-year-olds, which we're getting people to sign up, but it was initially we had the first clinic we had 43. This clinic this week, for Thursday, we have only 9 people signed up. So not a lot of demand for our services at this point. We'll continue to hold small sort of office-based clinics. We have 2 this week actually, with an adult booster clinic and a pediatric 5 to 11 booster clinic as well. But we're doing small numbers, but we want to keep that up. And then in terms of other activity, we've been working on our ELC and our Mrc grants, getting the approvals we need to accept the funds. And so we did get, I think I shared last month, we did get an award letter on the Mrc grant for $50,000, and the ELC is for $252,000. And so we've been to the Board of Selectmen and the Board of Finance, and both have approved that. We have to go to before the RTM later this month, to the committee meetings on the 20th, and then the larger meeting on the 27th, and hopefully those will be approved and we can accept those funds, or that allows the first selectman to sign to accept those funds, and then we can get started with those projects. Hopefully by July 1st we'll be able to get moving on those. We did, I think I shared that our data entry clerk had left us, so we did do some interviews and hired a new individual this week, and then she'll be starting in a few weeks to come on board. And I'll leave it at that, because I've got more to say, but I don't want to steal Rob's thunder.
Okay. So my name is Mrc Grants, Assistant Director for Environmental Health. I'm just going to give you an overview for the environmental program and what we've been working on recently. We started our beach sampling program again the weekend of prior to Memorial Day. That goes all the way to Labor Day. So far, no problems. So everything's going good, except State Labs filling samples twice on us. But besides that, we've been pretty good. Seasonal markets have temporary events, farmers markets, other events have really picked up again. Prior to COVID, we were very busy with it, and we're starting to get busy with them again. Every weekend there's a different event. Farmers Market, Greenfield Hill, also on the Green Hill, which we've been working on the weekends. Friday, Sands went out on an unfit house, which he had to post and have the individual move out. It's currently being cleaned out. We've been dealing with, as far as housing, we've dealt with that, or Sands dealt with that, but we also dealt over the last 6 months 2 relocations for ourselves. One of them was just a couple of days. The landlord took care of the problem himself, moved the tenant out of the basement that was illegal, paid for the relocation fees, and then the tenant found housing. We have one that's currently going on, which was a mom with 2 children in a legal 3rd floor attic apartment, which is current. When I say it's currently going on, the owner is currently paying for the relocation fees. It's going into its 2nd week. We can't get into too many details, but the attorney called me today with some issues of where those tenants are staying at the motel. The motel would like to see them move on to the next one because of issues, I guess you can say. With that said, so that's currently active. There's attorneys involved, but we were able to have that family move out, make sure that they were in a safer location. We are also currently training one of our former contact tracers as an intern, Sabrina Hudson. She has her master's in public health. She's interested in becoming a sanitarian, so we began to train her in the environmental program, doing restaurant inspections, doing her FDA trainings. She'll go on beach samples, so she becomes familiar with that. Housing, not necessarily as a hire for the town, but workforce development, so that we can help her potentially get a job either at our department or another department in the state. But that's currently other things that are going on in the environmental. There are other things going on, but the most pressing ones.
The housing ones have been, those are particularly challenging. It's, just to deprive someone of their residence is no small deal, and so it's from a legal perspective too. We have to protect the interests of everybody involved, and so it's definitely a challenging one. And Rob mentions it, but it's like, I don't know, you probably spend 50 hours dealing with that, and over the weekends and evenings and calls from the tenants and landlords and stuff. So it's a very challenging thing, and so just try to keep everybody up to date and aware, and the town attorney, and everybody knows what's going on, and so very challenging. And but it's ensuring that somebody's not in a unsafe environment, to be in a 3rd floor with improper egress. It's just it's something we just can't allow. We brought the fire marshal in, and he agreed, and so it's a challenging thing.
How was it brought to the attention of the town?
So the tenant actually made a complaint. She was concerned for the heat up there. It was just so warm up there, and she was seeing mice activity. And when we went there and I told her, there was a language barrier also, and I kind of explained to her that this is an illegal unit. It's a typical attic, if you think about it, one small staircase going up. And I explained to her husband, who translated to her, pretty much saying, this is illegal. And at that point, I think she kind of was like, maybe I shouldn't have called. But then the fire marshal got involved. They understood. That's how it really started. She thought it was just going to be a simple complaint. That turned into, you need to get out of here. And she has 2 children that are in the school system, so that became a challenge too. But
so how do you ensure the children can still get to their school? I mean, because I'm assuming the motel's not in their district, right? So
we, yeah.
The school contacted us back and forth, but the mom really dealt with the school directly, but you talked to the town attorney
And so we provided a copy of our order to the individual at the school system that handles sort of residency issues. And they indicated that would be sufficient to redirect the buses, to enable the buses to go to the location where they're residing now and pick them up. And so, but that's just, another one of the complications of this. So it's, don't like to do it, but very challenging. Yeah. And,
I don't know, I didn't have any communications. Does anybody else have any communications from the public? Anybody else bring anything up?
actually, can I just ask one question of Sam,
Sure.
about your report? Just regarding the 5 to 11 booster clinics, what kind of promotion has there been towards that? I haven't really seen much, to be honest. I just actually became aware a few days ago that they were even eligible, and I consider myself somewhat in the know.
Yeah. So typically what we do is, I think on that one we did a press release. We did posted it on social media. We send a townwide email around that gets sent to the school system as well. So we don't, once we send it to them, we don't, it doesn't necessarily always go out, but so that's really typically how we do it.
I feel like early on we knew a lot about the initial vaccines for that age group, and for boosters now, there's really not much out there.
Yeah.
I'm just wondering if maybe the low numbers are just simply because word's not getting out versus just apathy or reluctance, I don't know, maybe, I'm sure it's a combo of both.
Yeah, I think it's more of the latter. I mean, there's so much availability now. Before it was, there was less access early on, and then, and with the younger vaccine, there is just far less demand for it. There really is. I mean, we're still only at 53%, getting a first shot, for the 5 to 11-year-old group, so it's really that demand just isn't there right now. And from what the CDC is saying, the demand for the 6-month to 4-year-old one that's coming up will be even less, that they don't think a lot of people will be going for that. But we'll keep doing it, we'll hold a few pediatric clinics for the 6-month to 4s when it gets approved. But yeah, I mean, we've just been seeing that with all the, whether it's adults or pediatric, just not a lot of demand. So, doing out of the office for a few hours really takes care of that. But we keep trying to put it out there, in the typical venues that we do.
A dumb question, sorry. What happens, are we sitting on vaccines then? Like, what's the shelf life on them?
So early on, that was the case. We would get vaccine, early on it was, that we would get just what we needed, and, it was, everything would go. And then we had some surplus that we discarded, that expired. Right now we have relationships with, Griffin and other hospitals that will give us just what we need. And so we'll keep only a small stock on hand at any given time, so that we're not, and we can transfer back any excess that we have. So we'll keep some around, but they're less concerned about that now. It's about, before it was, we would stay till 2 or 3 hours after a clinic was over, calling people to use up the last in a vial.
Yeah. Mm-hmm.
And now they say, just, we'd rather you vaccinate one person and throw out the vials than not vaccinate them and have them go somewhere else. So.
Has there been any discussions with the pediatric groups in town? I mean, I assume that they're presenting the message to their patients individually, but is there have we had any contact?
Not us locally, but the state has indicated they've reached out to all the major pediatric practices too.
CHA has a lot of, on their social media too, kind of pushing it, but I'm surprised. So I teach CPR through them, and I'm surprised how many kids, because I teach, for babysitting class, 11 and up, and they said to take the class because it's on their presence, in their building, that they have to have their vaccination, not boosters, but at least be vaccinated, and I can't believe how many kids drop out at the very end. Because my classes are usually 30 or so, we get a ton of kids this time of year. Right. Half of them are dropping out when their parents reread the confirmation of the class saying you must show proof of your vaccination to come. I can't believe how many kids are not vaccinated in that age group, from like 11, usually we get like 11 to 14% coming. Really, the past 2 months, it's been like half the class, just dropping out at the end. But yeah, they've been out on their social media sites to get it and that kind of thing,
They can do what they can, only do what they can.
And I guess I would ask you to introduce yourself to the board and tell the board a little bit about what you're doing.
Yeah, my name's Grace Soto. I'm an intern. I go to Fairfield Bobo. I'm a senior this year, so yeah, I'm working with like public health nursing. So.
And how many hours are you doing with us?
60.
60 hours. Yep. Yeah. And she did a great job on. I had asked to promote for mosquito prevention, and you worked on the tip or treat, right? Well, that was you?
I think that was Abby Moore.
Oh, okay. I thought that was you. Okay.
Yeah, she's the other intern.
Okay. Yeah. So we did a social media post campaign on tip or treat, like with a Halloween theme to it, but tip any stagnant water containers over or treat them, and so, we're, but I'm sorry, I thought that was you.
So you're finishing you're graduating?
Yeah.
Congratulations.
Thank you.
Awesome. Was there any old business anybody wanted to readdress or discuss?
No old business?
New business.
And I would like to.
But I just want to know, because flu has been going up, and has anybody reported to, because over the past 2 weeks, it's been really kicking up. Has any statistics reported back to
We've heard that, but I haven't seen the numbers yet.
Okay.
Yeah, I mean.
A little bit last month.
Yeah.
Like maybe 10.
Yeah.
But we haven't
weeks
seen.
ago, they were like dying in the pediatrician's office. There were so many
Yeah,
coming
we
in
had
with.
a ton of people. It's starting to
Go back down again? Oh,
Yeah.
I saw a bunch in the ER, and it's declining now.
Yeah.
But yeah, you're right, there's a big surge there for a while.
Yeah.
And now we've seen some COVID flu positives together at the same time.
Yeah.
Oh, really? Well, that's
Had one of those today, actually, yeah.
Yeah.
Were they really sick?
No, the baby, he's doing all right, but just kind of cranky and miserable,
Yeah. Double whammy.
Yeah.
Very unusual this time of year.
Yeah.
Yeah,
Crazy.
it's very late this
year.
Everything
Yeah.
here, so
Yeah.
COVID just messed everything up.
Right. Just everything aside.
So I would, one thing I thought I would bring up is because I was asked about it, and the concept of, do we want to continue to meet in person, which we're perfectly happy doing, or would we want to consider transitioning to an online meeting like some other boards are doing? So for example, like the Board of Selectmen just meets online, and it's just a WebEx meeting, and they do that. So the question was posed to me, like, why don't you meet online, like other boards? And I said, well, we were remote for phone, and I think we did a couple Zooms, and then, people wanted to come back, and, there was sort of some pressure to come back and be in person. And then the other question that was brought to me, which I didn't, as long as I've been coming to board meetings, which is, 15 years now, we've always been 7:30 on Mondays, and someone said, you can change that, like if you wanted to meet earlier and like meet at like 6, or something like that, that's up to you, and you can do that. So I would put that up to the board to consider, and if we want to have a discussion about it, and see what people want to do.
Whenever I can come.
Yeah, I have Zoom fatigue still from the last 2 years.
I feel like there's a disconnect, even though you're connected, you don't feel like you're as engaged as personally at all via Zoom as I am in person.
Yeah, no, and I'm neutral on it, I agree with Zoom fatigue.
Yeah.
And fatigue, and
It is now, I changed it all.
Okay.
But okay, well, that was the only thing I wanted to bring up, just because somebody asked me about it, and I said, well, I don't know, we've never really discussed it other than going remote and then coming back, but.
We meet once a month. I like meeting in person too.
Yeah.
I kind of feel the same way. I think that get to know each other, and it's like the conversation could be a little bit easier, I think, in person. But,
Yeah, okay.
But I'm totally open.
Yeah, I could do either way, but if I had a preference.
I'd say 7:30 works for me personally too, because by the time I get home from work, I can feed the family and then get here, so it works for me, but I could work with another time also, so whatever the will of the group was.
Yeah, I think that's, for me, also 7:30, sometimes
Okay.
I'm working late and get here from wherever I am, the hospital or whatever, so.
Is it hard for you? Because are you
It is
staying here
not.
from 5 o'clock?
No, I go home, I
Do you and
went
then-
home, had dinner,
You go
walked the
home
dog,
and come back?
you know, I come back, yeah.
Yeah,
So
okay.
it's, which is fine, you know, like, it's just, you know, I have several nights like this every month where I'm out, so it's
Yeah.
like not just another
Well, now with
normal.
guests, you might wanna just hang around
I know.
town and
I
hang around so
know,
much.
I know.
Right.
Get on one of those scooters.
Yeah.
Yeah, I've ridden my scooter in one time, you know, this year so far, but, you know, was looking at the weather for tomorrow, maybe, we'll see.
Mhm.
Are there, any other comments or
Wow.
any other,
Yeah.
anything to discuss?
It's kind of you know, a busy month for us, but not, you know, I mean, like, these housing things really took up a lot of our time.
Yeah, and I
you know.
appreciate all the work, that's,
But-
all I would say about that is that I can imagine how difficult it is in that situation to have to go and to be involved in that. So I appreciate we have to keep people safe.
Right, and safety.
And that's good.
Yeah.
Before all, but it can't be an easy thing to have to engage in with the people who are involved, I'm sure.
Yeah, no, it's, you know, like, on Friday night, it was, you know, just an elderly individual that was taken to the hospital, and, you know, I have to tell the family, like, you can't live here, I gotta put a sign on the door that says nobody can live here, and, you know, and so it's, you know, for individuals, I think for individuals any age of having to relocate,
How did that come up? Was that a neighbor?
it's a wellness check, family members checking on an elderly relative, and, you know, luckily they found him, he was, you know, on the floor, but they hadn't heard from him in a couple days, and so they got him to the hospital, and, you know, so it's all, you know, there's good out of it, but, you know, we just had to, the home was in disarray and a little bit insanitary, so, but, you
It
know,
happens more than not with when we get, like, when they call 911 and the whole team comes and we get them in skills. It's like, sometimes in other towns, it's hard to get everything done and ready before we're ready to discharge them. And the insurance is like, okay, you're done, and then there's no safe place, it stops.
this individual luckily has family in the area, good support, you know, I met with the family members right there that night and said, you know, if he gets out, we can care for him and, you know, put him up and make sure he's okay. And so, but it's always hard, you know, we often spend time with the hospital social workers saying, oh, you know, he's got no place to go, like, can't come back here, you know, until some work gets done, especially if there's no support for the individual, if they're on their own, it makes it real challenging. So, we get social service involved and other services and volunteer groups and things like that, people come in and assist in those cases, so.
There's nothing else? Is there a motion to adjourn?
Adjourn.
Second.
All in favor?
All right, well, quick night, all right.